Hello and welcome to our exciting series with Robert and Sons. And today we are treating a topic that I have contemplated doing a number of times, talking about contact lenses and how to care for them as well. So with us we have our good old Dr. Osei once again. Welcome.
Thank you.
Great. Contact lenses. First of all, what are contact lenses and what do they solve? And why should we use it if we must?
Okay, so contact lenses, we don't have a lot of information, unfortunately, on contact lenses out there. But contact lenses, there are ranges of contact lenses from soft to hard to masking, a lot of different contact lenses. So the commonest one we have are the cosmetics and the prescription, that's all. But there are different types of contact lenses. There's one called masking contact lens, and that's prescribed for people that have like cornea abrasions, cornea scar. I don't know if you've seen some people with whitish cornea. Their eyes are kind of blind, and they don't want people to see this. So there are contact lenses to help them see.
So that's permanent?
Yes. You take it off, but it's called masking contact lenses. You put it on just to mask that eye. Yes. So those ones are there, and then there's a cosmetic one that everyone knows, which has colors without prescription, and there's a normal one, the prescription lenses, which most people know. That's contact lenses. They are alternates of spectacle prescriptions. So there's a way to I don't advise you buy contact lenses everywhere or anywhere, because contact lenses needs to be prescribed by the optometrist to help. Because there's a calculation for transposing your spectacle prescription to a contact lens prescription. It's not just right away. Some prescriptions need to be transposed to the contact lens prescription. So it will be better to get it from a licensed optometrist to help you see.
I mean, the difficult thing about this, I've contemplated it a number of times. I find it difficult to touch my eyes and put something on it. How difficult is that process?
It's not difficult at all. When you come to our facility, we will take you through how to take it off, how to put it on, the hygiene behind it, what you have to do step by step. And then we will take you through everything. And you will actually do it for us to see. We'll do it for you to see, and then you will do it for us to see before we even dispense it for you. So it's very easy to use. I know some people feel it's uncomfortable, but it's not. When you get a hang on it, you would actually love contact lenses.
Great.
Yes.
So what are the essential steps in sort of maintaining the lenses and putting it on?
Okay, so there are different types of contact lenses. There's the dailies, there's the monthlies, and the yearlies. So based on the type of contact lens you have, that's how you take care of it. For instance, if you have the yearlies, let's take the yearlies first. When you have the yearlies, it's valid for a year. So when you open it, it's for the year. And with that, you have to take good care of it, because when you open it, the least thing is contaminated. So when you open it, you have to keep it in a case with the contact lens solution. There's a way to do it. So the yearlies it's a little dicey to use the yearlies. The easiest one to use are the dailies. With the dailies, when you open it and you use it, you dispose it. You cannot use it again. So far as you've opened it today, it's done after the day. And then there's a month. That one, it's valid for the month. If you use it, you can use it for the month. And with the contact lens usage, there are things you have to do. Before you even use a contact lens, you have to have an assessment with your optometrist to see if you are eligible for using contact lens. If you are having some type of cornea problems, you might not be eligible for it. You have to see the optometrist. You are taking through the assessments. If you are given the green light to use the contact lens, we'll take you through it. There's an easy way to use a contact lens. You have to just have a good hygienic lifestyle. You have to be able to love to wash your hands as often as possible. So before you even take the contact lenses out, you have to wash your hands. You have to make sure wherever you're keeping the contact lenses after, if it's not the dailies and the monthlies and the yearlies, you have to make sure the container you are putting the contact lens is clean enough. The solution you are using is FDA approved. everything you're using is in good condition before you can use the contact lenses. If you are lazy, it will be difficult to use the contact lenses. But if you are dedicated in using it, it's very easy to use it. You will just take you through it. You just have to have good hygiene. That's it.
So what are some of the basic mistakes people do in handling of contact lenses, and how should they avoid that?
Okay, so contact lenses cannot be used for, you can't wear contact lenses and shower. You can't sleep with contact lenses. You can't swim with them. So all these things are a no for contact lenses. So when you have your contacts on, before you take a shower, you have to take it off. Before you go for swimming, you have to, and then before you sleep, you have to take it off. These are the things, the basic things you don't have to do. And when you're taking the contact lenses off, you have to always make sure the contact lens, you've taken it off before you sleep. I don't know if you've seen a video of a lady that had 30 contact lenses in her eyes, and it had to be taken off bit by bit because it had gone inside the eye because she wasn't taking it off. So with contact lenses, you have to make sure before you sleep, you take it off. Those are the things you should do. Apart from the hygiene part, you have to always make sure you don't be like, oh, I think I've taken it off, but I can't find it. Make sure you find it and it's out of your eye. Those things are the things you have to do.
Let's go back to the issue of daily, monthly, and yearly. Is this a duration for the prescription?
Okay, so when you run a test, your prescription is ideal for a year and two sometimes. The eyes changes, so the prescription also can change. But when we're talking about the contact lenses being dailies, monthlies, and yearlies, is the product and when you open it. So if it's a dailies, when you open it in a day, it's done. You cannot reuse it. And if it's the monthlies, use it for the month and it's done. The yearlies also. So when you open it, that's when you count for the year or the month or the day. Yes.
So talking about sleeping or not sleeping with it, showering it or not showering it, with the ones that have longer expiration, you take it off, you put it into some sort of solution.
Yes, in a container.
And then you
can use it again.
Okay.
But there's a way to do that. Mm-hmm. So when you take it off, so the first time you open it, let's take the monthlies. The first time, because that's when you can use it again. When you open it for the monthlies, you put it on. Maybe you are going to sleep. You take it off with a clean hands. So you wash your hands, you wash the container clean, and then you take it off. There's a way to take it off. There's an applicator, and there's a way to take it. Even if you want to use your fingers have to be clean. So when you take it off, you put it in a solution. You pour the solution on it, and then you keep it. The next day, when you want to reuse it, you just don't pick it up and put it on. You have to pour the solution away, put new solution before you put it on the eye. Yes, that's how the monthlies work. That's the same theory with the yearlies. Just that with the monthlies, it's only good for the month. So if you open it today being 2nd or whenever, it's for the month. At the end of the month, you cannot use it. With the yearlies, you can't use it.
You cannot or you should not. Because when we are spending money...
You should not. I repeat, you should not use it, because when you use it after the month, there's a likelihood of you getting an infection because it's been contaminated. So you should not. I know you'll be tempted to use, it's not damaged, it's not torn, I can use it again. But you should not use it after the month or the year.
Great. So what happens if someone accidentally sleeps with his contact on?
Okay, so
overnight?
If you sleep or swim with it, there's a likelihood of you getting something we call conjunctivitis, red eye. Mm-hmm. You would have red eye. Sometimes you would have discharge, pain in the eye. So you should come to our facility and then we will give you medication. But if luckily enough you do all these things and you don't get any symptom or any problem, we still advise that you still use the lubricant just to clear everything off. You take it off as soon as you wake up, and then you put the lubricant just to wash any debris on the eye. It's advisable just to do that, to be on the safer side if you don't get any infection. But if you do, we advise that you come. And if you put it on and you are finding it difficult taking it off, you can also come and then we will help you take it off.
How would you determine if a contact lens is damaged?
Okay, so when a contact lens is damaged, apart from the shelf life or the expiry date, if it's torn, it's damaged. If it's discolored, it's damaged. So the colored contact lenses can also have like some type of discoloration. So if you bought it and it was blue and now it's like light blue or deep blue, the color can also show that it's damaged. A torn contact lens could also show it's damaged. And a wrinkled, it should be like in a bowl form, like a bowl cone form. So if it's wrinkled in any type of way, it's also damaged. Those are the things that you should see that the contact lens is damaged, apart from the shelf life and expiry dates.
What could be some of the side effects if people do not follow the correct sort of measures and precautions?
So if people do not follow the rules of contact lenses, they can have conjunctivitis, cornea abrasions, cornea scar, and all those could lead to blindness in a way, with the cornea being responsible for 2/3 of our vision. So if you have any problem with the cornea, it can affect your vision. You can have blurry vision, you can have blindness also. So following the rules of contact lenses are very important. It's very dicey and delicate, but I think if you're able to follow the rules and do the right thing, you should be fine.
So let's take somebody who perhaps has the prescription or the type for a year. How often should people who wear contact lenses visit their doctors?
As often as having the spectacles. The contact lens is just an alternate for the spectacles. So if you visit the optometrist once in a year, you should do the same. Based on the type of contact lens you are using, if you are using the dailies, it means that you should have 365 pairs of lenses. If not, if you're using the monthly, you should have 12, which will cater for it. Even if the yearlies, I don't think you should use one for the whole year. I advise that even with the dailies, you can use it for at least 3 months, then you dispose and get another one, just to cut any infections or any conjunctivitis out of your way. So even though it's yearlies, we advise that you use it 3 months, 3 months.
All right, thanks so much, Doc.
Thank you.
Another exciting episode. So I'm now almost convinced that I can go for a contact lens as well.
Yes, you can come for the contact lens.
Great. So tell them, of course, how they can get your contact lenses as well as all the other amazing services that you provide.
Okay, so we have branches in Accra, Kumasi, and Koforidua. In Accra, we have Weja, Adabraka, Osudankwa, Adenta, East Legon, and Tema. And then in Kumasi, we have Abreport and Ahojo, and we have a branch in Koforidua. You can also follow us on all our social media pages, Robertson & Sons Limited, and direct all your questions to us. Thank you.
Thank you very much, and stick and stay for more amazing tips.